All right, well, thank you, Judy and Marion, and hello, everyone, and welcome to the session on building and sustaining a statewide simulation alliance. I have probably 30 or 40 minutes of content that I will talk about, and then I'd like to open it up for Q&A and be happy to hear what you're thinking and answer any questions that you might have. So our learning objectives for today are to identify ways to create a simulation alliance, articulate the mission and vision of the California Simulation Alliance, which is also known as the CSA, identify key stakeholders that you may want to work with, and list one thing that you can do to get an alliance started. Now, I just wanted to ask, and maybe you can put it in the chat, are any of you a member of a statewide alliance? If you could just put it in the chat, are you a member of a simulation alliance? So I can know what we're dealing with here. And if you also would tell me where you're from, like what country or what state you're from. So you just go up to the chat, click on that and type it in. No, and Norway. Hello, from San Francisco to Norway, my Norwegian roots. My maiden name is Tronstad, and I know that's not Trondheim, but it's Tronstad, and so I have roots there, Jens. Anybody else a member? Mississippi, hi, Stephanie. Anybody else? All right, well, we'll keep on that, and I will move on. But for those of you who aren't a member of a simulation alliance, I will tell you about ours. We're probably a little different than some of the others out there. The first thing I want you to know is that we're 12 years old, and that's pretty old for a simulation alliance, I think. And I'm going to talk about how we evolved and where we're at now, what COVID has done to us, and our sustainability plan and why we're sustainable after all these years. In about 2004, I think it was, is when I first got involved in simulation. And at that time, we received a grant from the Gordon and Betty Moore Foundation to create the Bay Area Simulation Collaborative, which is also known as the BASC. We've published this work multiple times because they gave us the funding. They wanted us to be a demonstration project so that we could then take what we've learned and move it into other areas. We replicated the entire model in Southern California, which is a huge geographic area. And we also have replicated this in Victoria, Australia, and in a few other states in the US. So once the BASC had completed that grant, which was in about 2008, we launched the California Simulation Alliance. And at that time, we had the Southern California Alliance Collaborative and the Bay Area. So those sort of came under the CSA. So our purpose is that we conduct educational simulation courses. We share best practice models. We stay up to date on the current trends and technology and best practices so that we can share those with hospitals and schools around our state. We also do interorganizational research, and we most recently completed a research study in 2020, and we were just published this month in February of 2021 in the Journal of Nursing, the Journal of Nursing Administration. And that journal has an impact factor. Our work surveyed hospital chief nurse executives to find out what's happening in the hospitals. Because in California, most of our simulations started in schools. So the schools were all purchasing mannequins. This is in 2004, 2005. Everybody had a mannequin. Nobody knew anything about the methodology or the pedagogy of simulation. And it was all about the mannequin. We have since evolved. Hospitals have adopted it. Standardized patients have been integrated. other technology, which I'll talk about later, such as VR, AI, computer-based education, Zoom, etc. So we try to stay on top of it and find out what's going on in our state. We also negotiate contracts with vendors for pricing agreements. And so we have a philosophy that we have about 4,000, maybe over 4,000 now members. And just to give you perspective, we've got about 400,000 nurses in California and 110,000 physicians. We're about 40 million in population. We have about 425 hospitals, and we have about 145 schools of nursing. So it's a big area, and we have about 4,000 members. So we still have a ways to go. So we want our members to have access to pricing agreements. So we have negotiated pricing agreements with several vendors. They're all on our website, so that when you purchase from them, you get a discount because you're a member. It encourages people to become members because they get this discount. And then we showcase the vendors on our website. So this is one revenue stream that we have. Okay, so they give us some sort of compensation for that ability. We're also the voice for simulation with our Board of Registered Nursing. Now, in California, in the United States, every state has their own regulation for simulation. In California, pre-COVID, our board allowed us 25% simulation of our clinical hours, and 75% had to be direct patient care. When COVID hit, we were able to, because of the strength of our organization, we were able to have the governor write a waiver to allow us to do up to 75% simulation in mental health, peds, and OB, and 50% in med surge. And that waiver goes to the end of this academic year. So we'll see what happens. So other states went up to 75 or 100% because our students were asked to not come into the hospital when COVID hit. So they said, we can't take students. And we had students who only needed 30, 50 hours left to graduate, and we were stuck. So we were able to negotiate that telehealth help counted for hours, VR, all of those things we got the board to allow us to do so we can get these students graduated. When COVID hit in March, so I'm going to say at the beginning of April, we had 14,000 registered nurse students that were ready to graduate in 2 months' time. 14,000. And so if we weren't able to bend the rules or get a waiver, they would not have graduated. So it's been a real challenge in California. But this is some of the work that the CSA does behind the scenes as a voice for others in the state. So we now have 7 regional collaboratives. This is our state. I live right here where that red arrow is. We have 7 collaboratives. We have one in the far north. It's called the Rural Area Simulation Collaborative. We have Capital Area near Sacramento. Bay Area is still going strong. And our Central Valley, which represents a large area of our state. We're actually a very rural state, if you can believe it. And then Southern California, which we're anticipating that that's going to break into an Orange County collaborative as well, because it's so big. We have Inland Empire Collaborative, and then San Diego. So and they don't report to me or the CSA per se. They're individual collaboratives in which we have trained trainers in each of these areas to teach. So in every single area, I have trainers, faculty that have day jobs as simulationists and that moonlight for us as faculty to teach our courses. And that was one of the goals, which I'm going to review, show you our model. Our entire educational model was built on Benner's novice to expert theory. And Pat Benner did her work in the early 80s, and she really talked about nurses moving from novice to expert. So we decided, if you've been a nurse or a physician or a respiratory therapist for 30 years, and now you're learning about simulation, well, you're going back to the novice phase. Okay, it doesn't mean you're an expert in sim because you have 30 years experience as a clinician. And so we developed our model around Benner's theory. And here it is, the faculty development model that we started in about 2006. And it is 4 levels, 1 through 4. At the same time, scenario development was going on. Our first 2 courses were really our novice and our advanced beginner courses. And then we moved into, then we moved into our level 3, which was really building confidence. And then level 4 is train the trainer. So from 06 to 09, we focused on the novices. And then in 10 to 12, we started building more competence and strength, really focused on debriefing, advanced debriefing. We incorporated an apprenticeship model, mentorship. We had specialty training. And so we're continually training those that are doing simulation. And now, up until from about 2013 all the way through now, we're really focused on building expertise and train the trainer. So we are training people to deliver our content where they live. So that is a model that we have set up, and now we have hundreds of trainers around the state, and our scenario development has really gotten a lot better, and it's been enhanced over the years. We now have over 100 evidence-based scenarios in our library. So we really had to focus on buy-in when we started this alliance. I wanted to build a critical mass of believers and didn't want to spend any time with the laggards, because there were lots of people who said, this is just a fad. I don't need to know this. And so I said, well, have a nice day. Come back and see me when you're a believer. But you only have so much time in your day, and you only have so much funding. So I really focused on the early adopters and the people that sat in the front row and said, I want to belong. And so those are the trainers the beginning group of trainers represented from all of the different collaboratives. We need to figure out a business model. How can we be sustainable with no grant funding? We leveraged the grant funding from the Basque. We leveraged some funding from the Southern California collaborative, which was funded by Kaiser Permanente Community Benefits Program. And we leveraged that, did as much as we could while we were in the grant period to then kick off the California Simulation Alliance and create a business model. And our business model I'm going to review, but I think it's important to figure out what your business model is going to be when you build an alliance. Where are you going to sit? Is it going to be in a school of medicine, school of nursing? Is it going to be sitting at a hospital? Is it going to be an independent entity like a 501c3? That's what we call that in the US. It's a not-for-profit status, and you have to pay for that. So I decided that I was going to convene meetings monthly to start and invite as many stakeholders as I could to get buy-in. So our business model is that we are a program of health impact. Now, healthimpact.org is our state's nursing workforce center. And it is a 501c3, which means it's a not-for-profit entity. It can go out and get grants, and it has multiple programs. So the California Simulation Alliance is a program. So when I bring in funding, it goes up to health impact and things are dispersed. We have our own cost center, if you will. We don't have our own board. With a 501c3, you do have to have your own board. And I know Arizona several years ago created a 501c3. They established a board. And I'm not sure how far they got. It's still in existence, but it's pricey. And then you have to have someone who's the chairman of the board. And if that person leaves, who knows? You have to have a plan in place. So I have an advisory committee that's comprised of everyone who's the lead in our collaboratives, as well as some very prominent physicians. I live in the Bay Area, so I am close to Stanford. And so Dave Gaba is on my advisory board, Lou Halamek, and they provide valuable input. I'm sure that most of them back in the day never thought we'd be this far along, but we are. So I don't have to pay taxes. We bring in revenue, and I pay our faculty, I pay myself, and the rest goes back to build programs and goes back to the bottom line of health impact. So that's our business model. Now, how do we remain sustainable? I charge a subscription fee. So you're not really a member, you're a subscriber. You subscribe to the CSA, and with that, you are entitled to all these benefits. And so with your subscription fee, which is nominal, and I take subscriptions fees from individuals or from institutions from in California or outside. I have members or subscribers from all over the world. When you subscribe, you get access, you get a login and password, and you have access to download all of our scenarios. And we have over 100 evidence-based scenarios that are reviewed every 2 years to ensure that the evidence is still there and that there's nothing has changed. We have courses that we deliver, and I'll talk about that, but you get a discount if you are a subscriber. And then you have access to our pricing agreements. So I actually had a vendor, one of our vendor industry partners was at a sales call, and they said to the person, "Are you a member of the CSA?" And they said, "No, I don't even know about it." And so he said, "Well, this is what they're all about. You should probably become a member, because if you become a member, you'll get a big discount." And so they signed up. So we work with our industry partners so that our subscriptions grow, and so do their sales. And we're really open, and I would say vendor agnostic. We don't push any one product. We have quite a few relationships, but when we are talking and out and about, it's really about simulation, not vendor specific things. So we do get course revenue. We get consulting revenue. Over the last few years, we have done a significant amount of consulting, and that's in space, how to build a center. We've done consulting on pre-accreditation types of things, and writing job descriptions and all of that kind of thing. And then we have vendors that just want to contribute and be on our website. So that also is revenue that we get. So our trend right now is to move towards virtual classes rather than on-site. And I think that COVID really pushed us to do that. Obviously, we had several courses scheduled, 2- and 3-day courses, and people have been asking for online, and we just didn't have the bandwidth to create online courses. There's so many out there. We recommend that everyone takes the courses from Pam Jeffries that are free as a prerequisite to coming into our courses. And so once COVID hit, we did a major pivot, and we decided, you know what? All these faculty out there that don't know how to do sim or debrief, we did 2 months of straight classes for anybody that wanted to attend on Zoom for free. We allowed them to have our scenarios. We had COVID scenarios. We've written 2 white papers on the value of simulation, one around the pandemic and the other just in general. And so we gave those all away for free. And I think it was May 1st, we stopped that. And then now we're just holding our virtual classes. And our faculty all know how to navigate Zoom, use breakout rooms. When we do our sim classes or our debriefing classes, we use trigger videos. We have created about 6 trigger videos. They're on YouTube, and you can just go in and do CSA or California Simulation Alliance on YouTube. And you can also download those for free and use them for training. We have a diabetic scenario. We have a SVT infant scenario. We have an asthma scenario. We also have an exemplar in debriefing, an exemplar in pre-briefing. And so we're really about educating as many people as possible, because we want everyone to be safe. In the pandemic, when they had to put everything online, a lot of faculty didn't know what the heck they were doing. And so we just want to make sure that we have safe education in a psychological safety container for sure. So right now, what we're seeing is that there have been a lot of grants awarded to organizations, in particular schools. And so then they contact us for faculty development. I have one client that received a grant through, I think it was the state of California, and her organization governs 3 or 4 colleges. And so she did 8 classes during the summer, and she just asked for another 6. And it's funny because she said, can you do these on the weekends? And I thought, I don't even know what a weekend is anymore, right? So I put it out there to the faculty, and they're like, sure, that's probably easier for me. I don't have to take a day off. So we are doing 6 classes in the next couple of months on Saturdays and Sundays. It's virtual, so it doesn't matter. We have a mentor program that we've implemented. We really feel like if you take one of our courses and you need help, you can sign up for our mentoring program. And one of our skilled faculty, and all of my faculty are certified healthcare simulation educators or operations specialists. I talked about our scenarios. You could take a look, and if you want one to view, I can send one to you for free. We started these subscription fees back in 2011 and then increased the fees in 2016, and recently in 2020 we increased our fees just a little percentage. So some of the top trends that we're seeing in SIM, at least in California this year, are really moving to remote learning. And I'm telling folks, if we're doing this all in a remote fashion, whether it's a computer-based, a VR, Zoom, what doesn't matter, but we need to document what we're doing and show our outcomes so that when these regulators come after COVID and say, okay, you're going back to the way you were, you can't use any more than 25% or 50%, whatever the case may be, we need to show them that this is effective learning. And our learners are enjoying it immensely. And why would they want to go back and sit in a classroom or go to a hospital and have to stand and observe because they can't touch a patient because the rules have changed in the hospital? In the US, it's a very different. When the hospitals are busy or they're in the midst of a crisis, a pandemic, any emergency type of thing, or when the accreditors come in, they say no students. They say goodbye. And so then we have to give them their hours, and this is the perfect methodology to give them the hours that they need. We're also seeing an increase in interprofessional education. Now, if a medical school and a nursing school, PT, OT, all of that aren't in the same campus, it's hard to do this. So we're seeing that people are importing students from other schools to come in and train together, which is great. But we really believe in our philosophy is that it's not interprofessional education if you take a learner in a sim and say, okay, you're going to play the doctor and you're going to play the nurse and you're going to play the respiratory therapist. That's not interprofessional education. Interprofessional is really learning together from different professions. So we're seeing a lot more of that around our state. And we have 2 new medical schools that just opened up that we're working with that are really excited about doing more IPE. We're seeing pre-COVID an increased use of standardized patients, and then all of a sudden it stopped because how do you do that on Zoom? And then we figured out how to do it on Zoom. So now we have SPs on Zoom talking to learners and still doing their thing on Zoom. But we're seeing more and more standardized patients, in particular in our state in the nurse practitioner programs. We're seeing an increased use of virtual reality. And I'm hoping that as a result of the pandemic, that once school starts up in the fall, that every student, whether it's nursing, medicine, whatever, is given a headset and told that they're going to be using VR as part of their learning. I'm hoping that'll happen because the return on investment is high. We're seeing a lot of systems integration, hospitals in particular using simulation to make sure that they're going to build a new cath lab or a new wing in a hospital, using simulation to simulate that hospital setting and working the patient through, admitting the patient, the mannequin, and then taking them through the steps for a heart cath or an operating room procedure, and to see how the system is adaptable to these types of things. And using simulation is great. We have some hospitals here that actually closed down because of the seismic issues that we had because of the earthquakes in California, and they've been reopened as simulated hospitals. So all the employees that are hired have to go through simulation in this simulated hospital before they can even touch a patient. And that includes our environmental services people and all of the employees. One trend that we're seeing here, and that the CSA has really helped push, is that our sim centers are now being identified as a clinical site. So what I mean by that is if you are a medical school or a nursing school and you're looking at finding a place to send your students, you might be able to send them to a center that has already talked to you and has your curriculum and has your objectives, and they can meet your objectives through a sim center rather than going to a hospital setting. And then we're seeing an increase in certification. There have been a couple of states in the US that are now saying that in order to do simulation, 50% simulation of your clinical hours, the person that's leading the program has to have a CHSE, a certification as a healthcare simulation educator. So that's good for the society because we're going to be doing more courses to get people certified. But I don't know if that'll be a trend or it's just a couple of states, but it's something to keep our eye on because the certification is an important thing. You have to have at least 2 years experience as a simulationist. And then accreditation is another thing. What we help our clients with is to prepare them for accreditation. So we can go in and make sure they have the policies and procedures in place, make sure they're following the standards. But more places are going for accreditation than before. It's a very prestigious designation. So here, I think this is Medvision's VR, a picture of what their VR looks like in the VR environment. And here as well. And I do believe that this is only going to get bigger. I have a pair of Oculus 2 headset. I have a headset and I have a couple of links that I'm playing around with. And I really am an advocate of VR. I think that and when you look at space, the CSA has done surveys all over our state to find out like how much space one has, what is the magic formula. And we have one hospital that has no space. Everything is in situ. Okay, it's in situ. They have mannequins in the closets. When the sim takes place, they pull them out. And the big centers that I'm seeing mostly on the East Coast, we don't have so many of those in California. And as we move to VR, how much space do you really need, especially if they're doing the VR at home, right? So I think we're going to see a trend towards smaller space, and that's going to be interesting. That's Medvision. Thank you for asking me to come today, Marian. Here is our website, californiasimulationalliance.org. You can navigate around. You can actually see the scenarios, but you can't download them unless you are a subscriber. But you can see what we're all about, what our mission, vision, and values are. And I want everyone to remember that it's not about the technology, it's about the methodology. And as I said, in about 2004 to 2008, it was all about the technology. And it was a struggle for us to teach clinicians how to also manage a mannequin, right? And so I believe the best model is to have a sim ops specialist with a faculty. And that is a trend that we have seen, and sim ops is growing and growing and growing. But I don't want to pay a faculty to get bogged down with technology. They need to be teaching. So it's really about the methodology. So that's me. And if you are on Twitter, please follow me and I post a lot of stuff on simulation, and I'd love to chat with you about things. So now I'm going to stop share, and I'm going to go to gallery view. Here we are. And we're going to open up the mic. Do I do that, or do you do that, Marion or Judy?
Judy, could you do that for all?
They should be able to unmute themselves now.
Okay. Anybody have a question? Comment?
KT, do you think these alliances, have you been more active with the alliances during COVID?
Yeah, I have been, and it's interesting because the state of Oregon we're like a sister state. We're right below Oregon, and the Bay Area Simulation Collaborative was based on the Oregon Simulation Alliance model. The entire state of Oregon is about the size of the Bay Area of California. And so I reached out to them and found out that they're no longer in existence. They sunsetted. The leader there retired, and so they don't have an alliance right now. So we're working with them. And that included Idaho. So I haven't reached out to Idaho. But I do know that there are alliances in Tennessee, in Florida, South Carolina, Maryland, some that are still fledgling, trying to get it together. I know Arizona, Hawaii, and others. So yes, we reach out, and I am available to all of them to talk about issues that they might be having, because we're the old gal on campus, I guess. So yeah, but everyone's struggling, especially with clinical placements during the pandemic.
And I did not realize that through the pandemic that you were able to do more simulation versus clinical. So they upped the simulation versus clinical portion.
In the US, there are 26 states that have no regulation at all on simulation. They can do whatever they want. There are about 7 or 8 states that are at 50% right now. There are 2 that are at 30, and there are 7 or 8 that are at 25%. And so the rest of them have no regulation. And even though we had that great study back in 2014, I think it was, through the National Council on State Boards of Nursing, the NCSBN, that showed that 50% simulation and no simulation, there were no change in outcomes. Each state has their own opinion on that survey and have either upped it to 50 or said, no, we're not moving. And my state isn't moving. Yeah, so it's an issue throughout the state, throughout the country. There's a question for you from Walter, Marion, in the chat. You see that? I'll read it to you. What are the benefits for you of using Medvision? What is that? Is that like a big iPad, that picture?
That is something, it's actually a prototype, and I'm really not the great person to talk about it, but it's a prototype and something that we are working on. We are a medical simulation company, and we have a line of patient simulators, but the VR product is something that we are working on, and we would love to share it with you. If you would like to, take a look at it and give us some feedback, you can look at the software and give us some feedback on it. We'd love to do that.
It looked like a big iPad.
Thanks, Walter.
It looked like you could just touch things. Yeah. Anybody else have questions about the Alliance, our sustainability plan? I do have a paper that was published in Clinical Simulation in Nursing on the sustainability of the California Simulation Alliance. And then there's one on the Bay Area Simulation Alliance in the Society for Simulation and Healthcare's journal.
And KT, you mentioned, I think you said that you'd kind of learned from the Oregon Simulation Alliance, but I guess I'm thinking that you were one of California and Bay Area. That was one of the first alliances, was it, or was it not?
It was one of the first. Maryland was out there. Indiana, Pam and her folks there has one in Indiana, and then Oregon. But we were the first I guess I would say, urban, regional, collaborative. And then we moved to statewide. And, every single state simulation alliance. And I actually did research on this a couple of years ago to find out who's doing what, how are they funded? Do they have an executive director? Do they have a volunteer? And I have that data. It's old. I'm hoping to refresh it. But a lot of them come and go. It's like, and here, the key is leadership, sustainable leadership. Because like I said, with Oregon, he retired and so nobody picked it up. In Florida, they were challenged as well. They were challenged getting someone to do this. Everyone's working so hard. So I think that every state is different. And the one in Australia, they're a couple years older than us. So, I had the very good fortune to be invited over there because they had some grant funding to launch their alliance. And then I said, just take everything we've got and do with what you want. And so they're the Victorian Simulation Alliance, which is the VSA, and we're the CSA. And I didn't have any money in my budget for a new logo. And they had 3 logos they were choosing from. They chose one and they had 2 left over and they gave one to me and I changed the V to a C.
There you go.
Yeah.
Well, this was great information for me. I mean, I learned a lot and I greatly appreciate it. Now, Judy, these will be posted on the IMSH site. These recordings and the presentations.
We'll gather them all and then Olivia will post them tomorrow. And they'll be on, I can do, if everybody wants the link, I can quickly do the link, but it's on the Live Learning Center that's part of FSSH.org. Just go under there and it'll link it up. All 4 of them that will happen today, they'll be listed.
Okay, because I'll certainly, I mean, I think this is critical information for us, for clients, customers. And so I would like to, post it socially where they can go find KT's presentation.
Yeah, I'm doing the copy now. Somebody asked for it, so I'm gonna quickly pop it and put it in the chat.
Thanks, Judy.
Mm-hmm.
I'm wondering where Ron and Yulia and Walter are from. And Joe, could you tell us where you're from?
Now they should be able to unmute themselves because I've taken all the restrictions off.
Brazil is Walter.
Being shy?
I think one thing I didn't mention, but I will at this time, is like, what's the difference between an alliance and the society? Well, there's a huge difference. I think that the society has a lot of things that they offer to a broad range of folks all over the world. And we're very specific to California, number one. And I would say probably 90% of my members are members of SSH. So, we promote SSH and INAXL through our newsletters and all of that. So we're very different. It's more of a community. It's more really focused on education than anything else. Pennsylvania, that's Joe. I think there's an alliance out of Pitts in the Pittsburgh area, or at least they were talking about it. SimPal, yes, that's the one. And Susie was involved with that. Susie Cardang-Egren.
Okay.
Well, KT, I'm very appreciative. I appreciate your time. I know, like I said, I feel like you're an icon. You're the leader. You're the GOAT, at doing this. And I appreciate it.
Oh, thank you.
Presenting. So you're presenting tomorrow to, where are you presenting tomorrow?
The Irish Association of Simulation. And I'm sad because I can't go there. I'll be doing the same.
I know, really.
Well, they actually said, it's a long way to Ireland. And so I pre-recorded my session and I'm wearing a green outfit because, Irish, right? red hair, green. And then
Of course.
tomorrow I'm going to put on the same outfit. I'm going to sign in for Q&A, just like I was there.
Okay.